Hello everyone, this is Shalom Tucker, and I'm going to be presenting my mini-study analysis table. The research topic or question that I chose is what alternative non-hormonal treatments serve as effective, safe methods for the management of PCOS. And the reason that I chose this topic is because of the personal experience I have and all that I've seen with women who struggle from the health burden that PCOS is, the symptoms of infertility and obesity, excessive hair growth, menstrual cycle irregularity, and so on. I believe that in finding some alternative non-hormonal treatments that are more affordable, also effective and safe, can be some information that us as midwives can offer to our clients. The first study that I came across is titled Combined Lifestyle and Herbal Medicine in Overweight Women with Polycystic Ovary Syndrome, PCOS, and it is a randomized control trial. The second study is titled The Effects of Flaxseed Supplementation on Metabolic Status in Women with Polycystic Ovary Syndrome, and it is a randomized open-labeled control clinical trial. The third is titled A Comparison of a Pulse-Based Diet and the Therapeutic Lifestyle Changes Diet in Combination with Exercise and Health Counseling on the Cardiometabolic Risk Profile in Women with Polycystic Ovary Syndrome, and it is a randomized controlled trial. The purpose of the first study is to discover if the intake of daily herbal medicine along with a lifestyle modification could be a safe and effective treatment for women with PCOS. The purpose of the second study was to assess the effects of flaxseed powder on metabolic and anthropometric statuses in women with PCOS. The purpose of the third trial was to determine the long-term effects that a pulse-based diet or a TLC diet along with regular exercising intervention could have on the cardiometabolic profile of women with PCOS. Participants for the first study included 122 women aged 18 to 44 years with a BMI greater than or equal to 24.5. These women were all diagnosed with PCOS according to the Rotterdam criteria. Participants in the second study included 48 participants who were also diagnosed with PCOS according to the Rotterdam criteria of ages 18 to 45. The women recruited for the third study were women ages 18 to 35 years old with PCOS diagnosed according to the AE-PCOS Society criteria. The first study was a randomized study. This trial lasted 3 months. The participants were split into two groups, one who took on the lifestyle intervention and the second one who took on lifestyle intervention along with herbal medicine. The second study was a randomized open-label controlled clinical trial with two parallel groups. The trial lasted 12 weeks, and these participants were also split into two groups, one who was assigned to a lifestyle modification, the second who was assigned to lifestyle modification along with taking 30 grams of flaxseed powder a day. The third study was a multidisciplinary single-blind metformin stratified parallel group randomized control trial, which was also the participants were split into two groups. One was assigned to the pulse-based diet and the second was assigned to the TLC diet. Both were required to also exercise daily. This study lasted 16 weeks and the women were followed up at 6 and 12 months after the 16-week intervention to determine long-term effects. The data collection varied from study to study. The conclusion of the first study was that herbal medicine combined with lifestyle modification is an effective and safe treatment for overweight women with PCOS. The second study conclusion was that flaxseed supplementation in women with PCOS could improve some biochemical and anthropometric markers for women with PCOS. The third study's results supported the claim that lifestyle modifications are crucial in the management of PCOS. Diet interventions that include aerobic exercises, health counseling, pulse-based diet, and can be more effective than TLC diet for improving insulin response. Weaknesses of the first study were that there was, there are two weaknesses that all three studies have in common: the lack of a placebo group and the fact that the participants were not blinded. The first study had no examination of the discrete components of the interventions, no examination of the relationship between herbal medicine and lifestyle modification. The second group was relatively small, the second study was relatively small, the smallest of all three, and it did not succeed in identifying a safe dosage of flaxseed powder. The third group study, I apologize again. The third group was relatively small as well, and the study received a poor response rate to the dietary recalls due to systemic error. The first study's strengths were that this study addresses the economic cost of PCOS causes yearly in the U.S., providing a possible way to reduce this cost not only in the U.S. but also around the world. The participants were able to benefit from the treatment and receive the opportunity to join support groups in their area. The second study, participants also found benefit from the treatment, and it is the first study to assess the effects of flaxseed powder on metabolic and anthropometric statuses in the women with PCOS. The third study, the women also benefited from the treatment, and the study included a long-term follow-up of participants, which is often a component that's neglected in PCOS research. Other comments. First study, even though the study is lacking a placebo group, the data collected regarding herbal medicine plus lifestyle modification daily can be a real game changer for women suffering with the symptoms of PCOS all around the world. These interventions may lower the cost of treating PCOS. The second study was quite small, but the participants showed great compliance. Flaxseed powder supplementation along with lifestyle modification can possibly be one of the options to add to the limited list of alternative treatment plans for PCOS. The third study. Although the study had a number of weaknesses, it is one of the studies that tackles the issue of finding a specified effective dietary program for women with PCOS. This study really went into detail on what that diet looks like, what foods to eat when you have PCOS, and which foods not to eat. This study also went into the long-term effects that these interventions had on the participants, something that many other studies, like mentioned before, do not have. Thank you so much for listening, and have an awesome day.